Okay, so we're just going through answers today to this practice SAC. So yeah, I'll just go through it. And if you have any specific issues, just stop me or let me know in the chat box. Okay, so the first question was, the cumulative risk model adopts a something approach to evaluating the effect of risk factors on development of mental health disorders. So the answer is B. Okay, question 2. Which of the following terms best describes the thoughts that a patient has about their specific phobic stimulus? The answer is C. So C. Question number 3. The significant anxiety that a patient experiences when they encounter their phobic stimulus must continue or persist for how many months, guys, do we think? I'll let you guys have a go with that one. 6, yeah, 6 months. Okay, so it's got to persist for at least 6 months. That's the diagnostic criteria. Question 4, protective factors can offset or reduce the risk, always prevent the development, prevent recovery, have a positive or negative effect. What do we think, guys, for question 4?
Miss, our first question was different. Which SAC is
this? Is an updated version, Zoya, because the first version I uploaded had a few too many questions about phobia in it. So that's why I re-uploaded this version, I think the night before or the day before.
Oh,
yeah.
Like yesterday?
Not yesterday, I think the day before yesterday.
Oh.
Yeah, so just go and download the updated version.
Oh, okay.
Yeah. Okay, so question 4, protective factors can. What do we think, guys? There are 4 options there. Tell me which one you think is the best answer. Yeah, A, excellent. A is the best answer. It can't be B, even though B looks like it could be the answer, because B contains the absolute word always. And always is a little bit too confident. It's a little bit too absolutist, which means that, you know, protective factors don't always, for example, prevent the development of a mental health disorder. Okay, they can, but if your risk factors are too much, they may not have much of an effect there in prevention. So that's why the best answer is A. Question 5, Jocelyn refuses to go camping because she has a phobia of spiders. She is convinced that if she went camping, hundreds of poisonous spiders would crawl into her sleeping bag at night and bite her, leaving her paralyzed and horribly disfigured. Jocelyn's belief is an example of, so what do you guys think? What type of cognitive process is she showing there? Yep, catastrophic thinking, good. Because the way she's thinking is very like worst case scenario. It's very kind of exaggerated, kind of looking at what catastrophe could happen. Okay, so that's why the cognitive bias that Jocelyn shows there is representing catastrophic thinking. Okay, question 6. When Marianne was flying home from an overseas holiday, the plane entered an area of high turbulence, causing excessive shaking, causing the oxygen mask to drop from the ceiling. Ever since then, Marianne has been unable to even consider flying in a plane without becoming significantly distressed. In terms of social contributing factors, Marianne's phobia can be attributed to, what do you guys think? What kind of social contributing factor? Yeah, A, specific environmental trigger. Good work, because specific environmental trigger is like any experience that the person goes through. In this case, Marianne's experience was a direct exposure to that traumatic stimulus. But even if Marianne had seen a movie about people who were, you know, about to crash in a plane or something like that, that could have also acted as a specific environmental trigger. So A is the best answer there. And we know that when we learn phobias, guys, there's only 2 social contributing factors we learn about anyway. They're specific environmental trigger and stigma. So those are the only 2. So lack of social support isn't really a factor there at all. Okay, question 7. Andrew has a phobia of peaches and decides to try systematic desensitization as a possible treatment. Which of the following would best describe a possible fear hierarchy for Andrew's phobia, from least threatening to most threatening? So remember, when we build a fear hierarchy, we order the task in terms of least scary or least fear inducing. And then as we go higher up the hierarchy or higher up that ladder, we start to see the task getting more and more scary or more and more fear inducing. So following that concept, guys, what do you think is the best possible fear hierarchy? Yeah, C. Because look, eating a peach straight off the bat is pretty fear inducing for most people. Touching a peach can also be fear inducing. Remember we said the more and more it gets closer to you actually encountering the thing in real life, that's when that represents what a fear hierarchy is. So looking at a drawing of a peach, looking at a photograph of a peach, touching a peach, and then eating a peach kind of shows you that step by step kind of each time you're going up one step in terms of fear inducing nature of those tasks. Okay, so that's why that's the best answer there. Okay, question 8. Which of the following best describes why informed consent can become an ethical implication in patients with mental health conditions or disorders? So what do you guys think? What did we say about informed consent with reference to? We used a specific keyword there. And if you know that keyword, you can know this answer here. B, excellent, good work. So B is cognitive impairments. People who have mental health conditions or disorders often have cognitive impairments that stop them from being able to process the information in the informed consent form, as well as other people, or make proper decisions about whether they should participate. Okay, so that's the question 8 there. Question 9, a key feature of rumination as a psychological risk factor for mental disorders is that. What do we think? What did we say about rumination? There was a specific characteristic that makes it different from overthinking in normal life. Yeah, C. The person does not engage or act in any behavior that helps to change their stressful situation. So remember we said that when you're overthinking, like as a person who doesn't really have a mental health disorder, you overthink, but sometimes that leads to you doing something to change your situation or doing something to ease your stress. People who ruminate though, and rumination is seen in mental disorder patients, like people who have depression, for example, these people, what they do is they overthink, but they don't do anything or act in any way that helps them to change their situation or their stressor. So that's why C is the best answer. Question 10. Matthew works as a manager for a large-scale company. Due to COVID-19, company has been under much stress. Many staff have been laid off, which has increased Matthew's workload. He's trying his best to adjust to the situation, to be as resilient as he can. Which of the following describes how an adequate diet will help Matthew to develop and maintain his resilience levels? So this is kind of the topic that we went through yesterday. Read through those options and see which one makes the most sense in terms of adequate diet and linking back to resilience levels. Yes, A is the correct answer. Good work. So A is the correct answer because eating a nutritious diet will provide Matthew with enough energy to adapt to his workload. The rest of them don't really make much sense with reference to resilience, simply because remember yesterday when we were talking about resilience, we said there are 3 main keywords we're looking for in any answer. Either the word adapt, adjust, cope with, bounce back, or return to normal functioning. These are like literally all the possible options in terms of keywords that you want to look for in a multiple choice option, or that you want to include in your own answer if it's a short answer question, to indicate that you're making a link back to resilience. So none of the other options indicate anything about adapt, but the first one does. And obviously enough energy makes the most sense with reference to eating a nutritious diet or eating an adequate diet there. Okay. So that's the basic idea. Consuming a keto diet will help Matthew to maximize his energy levels. Look, we don't learn anything about keto. And again, there's not a lot of evidence that keto helps everyone to maximize their energy levels. So that first option is the best answer for us. Okay, question 11. Aisha is in year 12 and is a mentally healthy individual who shows high levels of functioning. Which of the following is likely to be true about Aisha? So think about what high levels of functioning, what those kinds of people show. And tell me in the chat box, what do you think the best answer would be for this question? Yeah, B. A few people saying B, that's correct. Okay. People who show high levels of functioning, they tend to participate more in those extracurricular activities. Remember, we said they tend to be more like for example, school captain, or they might be on SRC, or they might be in the debating team, or they might be, very, participating a lot in inter-school sports. Okay, all of these are extracurricular activities that show that they like to go beyond just the basic kind of coming to school and doing the work kind of thing. So that's basically high levels of functioning there. Question 12, psychoeducation relating to specific phobias aims to, and if you remember, psychoeducation was a social evidence-based intervention for phobia. So which is the best answer there? Yes, D is correct. D is the best answer. The reason being that even though A, B, and C individually are all correct, remember A is like the actual definition for psychoeducation, and then B and C are the two components or the two kind of things that we do as a result of psychoeducation. Okay, those are the two kind of components of psychoeducation. So all of the above is the best answer there. Okay, question 13, and I think we already discussed this a little bit before. Question 13, resilience involves. So what is resilience, or what does it actually involve, or what does it mean? Yeah, C. Okay, remember that the second half of the definition of resilience is about, being able to come back or return to a normal positive mental state of functioning, or to a normal state of mental functioning. What that means is you're going from a state where you are really stressed and really anxious or really upset or not in a good mental place, you're going back to normal state. Okay, that's the key idea behind resilience. So that's why the best answer is C. Okay, people who obtain adequate sleep are less likely to suffer mental health issues because, so this is again connected to chapter 14 and how adequate sleep can prevent mental health issues and can build up our resilience. So what do you guys think? Yeah, option D is the correct answer. So option D is the correct answer because that applies to everything. Look, people who obtain good amounts of sleep, they are less moody, which will make their mental health situation better. They are more rested and refreshed, which will make them feel stress and anxiety in a different way. Remember, I gave you guys my example how when I'm sleep deprived, I feel like I can't handle stress as much as I can on a normal basis. And they can control their emotions in a more effective way. So we know that people who don't have enough sleep, who are sleep deprived, show effective effects of sleep deprivation, like snapping at other people or crying at a little thing that normally they wouldn't cry for. So all of the above is the best answer there. Okay, question 15. The cognitive component within cognitive behavioral therapy aims to. What do we think, guys? Thinking about what cognitive behavioral therapy is about. What's the cognitive part of it really about? Yes, A is the best answer, okay? So in cognitive behavioral therapy, or the cognitive component, what we're doing is that we are reconstructing that. So we're taking a negative, unhelpful, or irrational thought, and we're literally like putting it through a machine and making it into a positive, productive, and helpful thought, okay? With the main idea being that if we can think positive, then we can hopefully also be positive, okay, or behave positively. So that's why that's the best answer. The answer cannot be C, because C actually refers to the behavioral component of cognitive behavioral therapy rather than the cognitive component. So that's why B, C, and D are not really the best answers there. They're all behavioral examples rather than cognitive. Okay, question 16. Which of the following is correct about the effect of GABA agonists, such as benzodiazepines? So this one's a little bit confusing because of the wording. It's very wordy and it's kind of tricky. So just read the options and see what the best answer is there. Okay, got some people saying a specific option in the chat, which is correct, which is good. Okay, so the answer is actually B. Okay, the answer is B because in people with, and this is a tricky multiple choice, in people who have specific phobias, remember we said that they experience what we call as a GABA dysfunction. Yeah, GABA dysfunction basically means that their GABA is less available, or it's kind of less efficient. So it's already reduced. So that's why we can't really choose the option D there, okay? Because we don't want to further lessen the levels of GABA that are available to them because GABA is already experiencing dysfunction. Option D, a lot of you mentioned because I think you saw the word mimic, which is a key word, but the second half of that answer is not correct. So that's why that becomes an invalid response, okay? The best answer is question 16. I'm sorry, option B, because it says they activate, okay? And we know that benzodiazepines activate that receptor site, remember? And that leads to the activity of GABA becoming boosted or enhanced at that receptor site. So rather than the person having a GABA dysfunction, the GABA is now kind of activated a little better and it works a little more efficiently there. So that's the basic, that basic idea. So always important to read the question properly, because sometimes the first half of the multiple choice option looks correct, but then the second half is wrong. See, in this option C here, we put the word glutamate. Okay, and we've reduces the activity. So we can mix up the words here and there and it can get a bit confusing. So that's why the option is B. Okay, our question 17. If someone helps another person by paying their rent for 1 week to reduce their stress, what kind of social support would this be classified as? Remembering that our memory tip for social support was ATI, the 4 types of social support we went through yesterday. So what type of social support is that? When you're actually engaging in materialistic help, or you're actually engaging in like help that involves actual resources like money? Yeah, correct. B, tangible assistance. Remember, tangible means something that exists. Tangible, actually, when you look at the definition of tangible, tangible means like, tangible means actual. It means like actual or like real. Okay, if I talk about the tangible, like what are the tangible benefits of this program? That basically means what are the actual like real life benefits? So we know that money is real. Money is a real life resource. And so for that reason, paying someone's rent is an example of tangible assistance. Financial support, some of you might have chosen, but this is not a key word. Okay, as we see, the memory tip is ATI. There's no letter F in that memory tip. And so for that reason, tangible assistance is our actual keyword there. Okay, question 18. Which of the following is not a stage of the transtheoretical model of behavior change? Remembering our random memory tip, pretty, cows, poo, and moo, to give you a little bit of a recap. Which of the following is not? Yeah, if we look at our memory tip, pretty, cows, poo, and moo, there's no R in there. Okay, so rebound is not a stage. In fact, rebound is not a stage, but some of you might confuse the word rebound with relapse. Okay, but it's important to confuse with relapse. Maybe. Some of you might confuse the word rebound with relapse. Actually, relapse is not a stage either. Okay, even though we talk about relapse with reference to the model, relapse is not really a stage, but an experience. And that experience can occur at any stage of the transtheoretical model of behavior change. Okay, so it can occur at any stage there. So it's important to remember that relapse is not a separate stage within the model, and it can't be a separate stage because, like we said before, it's an experience that can happen at any point. Okay, if it was a separate stage, it would have to be permanently fixed at some part of the model, but it can happen at any time. Okay, so that's why it's not a permanently fixed stage. All right, question 19. Macy experiences high levels of anxiety before each SAC. However, when her teacher tries to talk to her about extending her SAC date, Macy rejects the offer and says she will do it on the same day as everyone else, even though she knows it will be difficult to do so. When Macy rejects the teacher's offer to extend her SAC date, this acts as what kind of risk factor? So now you have to think about Macy's rejection of the teacher's offer for help and think about how it's affecting her in terms of her mental health state. So this, again, is kind of a tricky question as well. But see how you go. Yep, some of you are giving me the right answer. That's good. Okay, the answer is C, and I'll tell you why the answer is C. The answer is C because when Macy rejects the offer that her teacher's giving her to help, what she's actually doing is she's rejecting help. When you reject help, whether it's the teacher offering to extend the SAC date, whether it's your friends trying to check in on you and see how you're going, whether it's your parents trying to give you some extra space or whatever, rejecting help is always equal to preventing your own recovery. Okay, particularly when that help comes from a good place or comes from a person who's got good intentions for you. So rejecting help is preventing your own recovery. And as a result of preventing your own recovery, you're maintaining your condition. In this case, Macy is maintaining her high levels of anxiety. Okay, and for this reason, all these words like preventing your own recovery, maintaining your condition are all examples of key terms from the perpetuating risk factor. Okay, so that's why perpetuating is the best answer here. Precipitating can't really be an option here, although some of you mentioned that precipitating is not the answer here because Macy rejecting the offer for help is something that she does on her own. It's a decision that she makes. And so precipitating factor would be more like something that happens that increases her already high levels of anxiety. So for example, maybe a friend having a big argument with her at school, that would be a precipitating factor. Or maybe her parents breaking up during her VCE, that could be a precipitating factor. More often than not, precipitating factors happen outside of our control. And not always though, but more often than not they do. And they can lead to the worsening of our condition there rather than a prevention of our own recovery. Okay. Again, kind of confusing, but in a situation like this, always look at what the person is doing, is that preventing their own recovery? If it's clearly preventing their own recovery, and if it's something that's kind of in their control most of the time, then you can say it's a perpetuating factor. Okay, remember how we also said substance use can be a perpetuating factor, okay, because it stops someone from recovering as well. Okay, so that's question 19. Question 20. Betty is a 19-year-old girl who wants to reduce her consumption of junk food. She had been thinking about making some changes in her diet and researched online to see different food selections as well as nutritional information about foods. She feels like she needs more information before she can actually start making any changes. So in which stage of the Transtheoretical model might Betty be situated? So we've got 4 stages there. What stage do we think she's in? Yeah. So you guys pretty good with this one. This is D, okay? Contemplation. It's not action, okay, because she's not showing any physical change just yet. It doesn't say that she started eating carrots, for example. It doesn't say anything like that. It's not maintenance because obviously if it's not action, it can't be maintenance. It's not preparation either. And the reason it's not preparation is that preparation is a more active stage where you're planning. But the last line of this sentence is she feels like she needs more information. Okay, so she's not yet like purposefully planning just yet. Okay, she's still in that stage of contemplation. And we said that in contemplation, you can do light planning. Remember, we said that generally in contemplation, you can engage in light planning or like, light research there. But it's not as in-depth or as extensive as we would see in the preparation stage. So that's why the best answer there would be contemplation. Okay, question 21. Betty is successful in her attempts to eat less junk food and manages to maintain her healthy diet for almost 1 year. So that's more than 6 months. However, at her university graduation party, her friends encourage her to have a treat and take her to an all-you-can-eat chocolate buffet. Betty's unable to control herself and eats all sorts of chocolate during that night. She falls into her old eating habits again, continues to consume junk food for the rest of the month. Okay, so now in what stage, or I shouldn't even say stage, we should just say which component of the Transtheoretical model might Betty now reflect, or something like that. Okay, so what do we think is the best answer there? Yeah, D, it's relapse. Okay, she's falling back into her old eating habits again. When you fall back into a bad habit again, that indicates relapse has occurred. And relapse can occur at any stage of the model. It's more likely to occur in the action stage or after the maintenance stage has been established, but is likely to occur even in the pre-contemplation, contemplation stages can occur there too. Okay, question 22. I'll just bring this question onto the next page. Okay. Tom has a smoking problem and has been smoking for the past 25 years. His family and friends keep telling him to kick the habit, but he seems to not have any plan to change his behavior. Does not see any issue with his smoking habit. In which stage of the Transtheoretical model might Tom be situated? So what do we think, guys, when you're in the meh stage, when you're in the stage like, I don't care, it's not a big deal? Yeah, pre-contemplation, that's correct. So pre-contemplation is, remember, before you start thinking. This is the first stage of the Transtheoretical model. This is the stage where you're not bothered. You're like, meh, I don't care. It's not a big deal. I don't see the problem. This is the stage where you're thinking all of those thoughts. And we can see that in this scenario, Tom is reflecting those kinds of thoughts there as well about his smoking habit. Okay, question 23. When Rebecca's beloved cat passed away, she was upset and even took 2 days off school. However, when she returned to school, she was able to discuss her grief with her friends, attend after-school debating meetings to prepare for upcoming rounds, and also focus on her schoolwork. So what do we think Rebecca is demonstrating here in this situation? Yeah, she's representing or she's reflecting or demonstrating resilience, okay? And she's demonstrating resilience because she's gone through a hard time. She's gone through some adversity, which is her cat dying, okay? And she's been stressed as a result of that adversity, but then she's bounced back. And as a result of bouncing back, she's come back to school. She's, doing her normal activities. Okay, so she's allowed herself a little bit of time for stress and for grief, and then she's able to bounce back. She doesn't allow that to completely take over and bring her down or make her stop living her life. Okay, so that's basically showing a lot of adaptation, a lot of adjustment and coping skills. So that's indicating resilience there. Okay, let's go to the next one. So question 24. Gamma aminobutyric acid or GABA works to reduce anxiety in specific phobia patients by. So what do we think the answer is, guys? Yeah, the answer is A. Okay, remember we know this from unit 3, we know that GABA is an inhibitory neurotransmitter, and we know that in people who have specific phobia, they tend to overthink a lot. Okay, and that leads to a lot of release of glutamate, which is the excitatory neurotransmitter. And those people who have very overexcited brains, or there's a lot of overexcitation of neural activity, we need GABA to come in to reduce that anxiety, because GABA works against glutamate, or an inhibitory neurotransmitter always works against or counteracts the activity of a excitatory neurotransmitter. So that's why the best answer there is A. Okay, our last multiple choice question. So with reference to a person's susceptibility, which means increased chance of developing a mental health disorder, stigma, something. So what does stigma do? Which of the following options is most correct about stigma? Yep, the correct answer is B. Okay, the correct answer is B, because when we talk about stigma with reference to mental disorder, we focus a lot on how it stops people from being able to access treatment. Remember that example I think I gave ages ago where I said, okay, look, if I've got a mental health issue or something like that, but I don't want to, go and see the psychologist out of school because I'm worried someone will see me and then start talking about me, or they'll start making judgments about me, or they'll confront me later on like, oh, I saw you going to the psychologist's office. Are you okay? So generally, because people don't want to encounter that judgment, they generally, stigma is that negative labeling or that negative judgment that people with mental disorders experience. And so that can often actually affect how a person with a mental health disorder accesses treatment and whether they recover on time or whether their recovery is delayed or prolonged there. Okay, so that's the basic idea. It's not option C, although some of you may have said that it's option C. It's not option C because although stigma is negative, just like discrimination is negative, stigma doesn't always translate to negative behavior, and discrimination indicates behavior rather than judgment. Okay, someone with stigma is not going to, for example, exclude someone from their friends group because they know that that person has depression. Okay, but they might secretly judge that person, like, oh, why can't they just, buckle up, and why can't they just, take stress like everyone else? Why do they need special treatment? So if you think like that, that's prejudice or that's judgment, and that's what stigma is. But stigma is not negative behavior or negative discrimination. So that's why option C is not accurate there. Alrighty, any questions, guys, about any of the multiple choice questions that we've gone through? All good? All right, cool. All right, so we'll move on to the first question of short answer then. So the first question of short answer says, identify any one characteristic of a mentally healthy person and describe an example of how they could demonstrate this characteristic in everyday life. So if anyone in the chat can name a characteristic, we can just go with that one. We know that there are three, so I'll just mention all three first. Or maybe I'll let someone name one and then I'll name the other two, just to give you guys a go. Resilience. Yeah, resilience, high levels of functioning. Okay, does anyone remember the last one that we learned in chapter 11? Social and emotional well-being. Okay, so yeah, social and emotional well-being. So all you're doing for this question is you're naming any one of these. So that'll be 1 mark for naming. And then you're describing an example. So when you describe the example, that's another 1 mark there for you. So if I just name, for example, resilience, that's 1 mark. And then I say, this refers, or, oh, I don't need to even define it because it just says describe an example. So I could say a person with resilience or high resilience is likely to be able to cope with and adapt to stresses. Example, continuing to study for the next SAC after not doing so well on a previous SAC. That's resilience. That's your ability to not let that situation bring you down completely, but basically being able to keep moving on and keep trying your best, kind of thing. Okay, so that's one mark there for the example. Okay. Social and emotional well-being, high levels of functioning, the same thing. Look, with social and emotional well-being, the only issue if you chose that one is that you have to discuss both social and emotional well-being. So in these kinds of questions where you have a choice, it's always better to try and, try and choose an option strategically. So choose an option that is most strategic in terms of, you writing the answer there. Okay, so that's basically what resilience is, or that's basically one example of an answer there for you, okay? So always important, guys, to read the question properly, because often in one single question, there are like 2 or 3 parts you need to address. And this is why some of you lose marks in previous SACs, because you only address the first bit of the question, but not the second bit or not the third bit of the question, or you miss one bit of the question completely there. So just make sure you read that question properly and, just make sure you address all parts of that question. Okay. All right, question 2. So this is a pretty straightforward question. You're just naming a factor that could influence mental health. So if anyone wants to volunteer an answer in the chat, what's an example of a biological factor? It doesn't have to be a risk factor. It could just be a general factor, or it could be a risk factor if you want as well. It doesn't really matter. They will all still be correct.
Can you say genetic vulnerability?
Yeah, genetic vulnerability or genetic predisposition, definitely. Okay, alternative, wait, some answers in the chat too. Yep, so alternative answers there could be like, for example, neurotransmitter levels in the brain. We know that people with some mental disorders have different levels of neurotransmitters, the influence of hormones. Okay, you could even say an example of a biological risk factor is your sex, whether you're male or female. Okay, we know females tend to have higher levels of depression than males. Okay, so those are all examples of biological factors there. Okay, any psychological factors now, guys? I've just given you a bunch of answers, but you only need to name one in each box there. Yep, stress, definitely. Stress is always a psychological factor. Yep, so impaired reasoning and memory. That is a psychological factor as well. What else can we talk about? Let's see. Self-esteem levels, yeah. Self-esteem levels. We could even say self-confidence, and we could even link this to self-efficacy, which is something we've talked about in chapter 12. Other psychological risk factors we can talk about probably relate to social lack of support. Yeah, so social, yeah, we can talk about social support levels from friends and family. So whether you have enough of that or whether you don't have enough. Okay, in social factors, we can even talk about the actual access to services within the community. Okay, those of you doing health might understand that when we talk about social factors, we can talk about, we can talk about access to services within the community, such as access to services like psychologists, example, psychologists, mental health services, all of those also act as social factors. Yep, geographic location, loss of a significant relationship. Yeah, all of that also comes under. Relationship. Yeah, and geographical location is another good one because, again, we know people living in rural and remote areas of Australia tend to feel higher levels of social isolation and have higher levels of depression as a result of that compared to people in the metro. Alrighty, so those are some good examples there. Literally any factor. It could be a general factor that we've learned in chapter 11, or it could be a more specific factor from chapter 12 or 13 there. But yeah, those are just some examples. Again, it's worth 3 marks. You've got 3 boxes, 1 answer in each gives you the 3 marks there. Okay, and you don't have to explain because it just says give an example. Okay, question 3. Shelley has schizophrenia and has been recruited to participate in a research study that will trial a new drug to better manage symptoms of psychosis. When Shelley goes to meet the research team, she is accompanied by her parents. Outline why informed consent can become an ethical implication for mental health research with patients such as Shelley. So can anyone give me any keywords I might include in my answer here? So I'll start off by saying, as Shelley has a mental health disorder, and then in brackets we can write schizophrenia. Okay, now let's complete that up. What would we say? What's a keyword we might include? Yeah, cognitive impairments. She is likely to experience cognitive impairments. Okay, so we've mentioned the word cognitive impairments. Now we need to unpack what does cognitive impairments actually mean. So that's 1 mark there for mentioning the fact that she's got a mental disorder. She's going to experience cognitive impairments. This means that, what does cognitive impairment mean, guys? What does it actually, how do we unpack that with reference to this question here? What difficulties might Shelley experience?
In decision making?
Yep.
Like giving like informed consent because they don't understand all the elements of the study.
Yep, excellent. So we can say difficulties in processing information, understanding all the elements of the study. And then we can tie it back to what Safa said about making the actual final decision, understanding all the elements of the study. And then finally, making an informed decision. Okay, so that will be 1 mark. Okay, you can also mention how this makes it difficult to determine whether Shelley took part in her own will, on her own will. Okay, well, I wouldn't really say took part. I'd probably say provided consent on her own will, kind of thing. Okay, so that's basically 1 mark for indicating cognitive impairments, 1 mark for unpacking, okay, that particular thing there. And you notice we've tried to link back to Shelley, we've used her name, we've linked back to her mental disorder that was in the question as well. Okay, so that'll give you the 2 marks there. Okay, question 4. I'll just bring question 4 to the next page. Okay, so question 4 is a scenario-based question. Looking at big scenario. Okay, Neil is terrified of cats. If he encounters a cat in the street, he will panic and sometimes feel as though he's about to have a heart attack. When at home, he often finds himself remembering prior experiences with cats. And when he does this, he always remembers them being far larger and far more threatening than when he encountered them. When he sees a cat, the first thought he has is that they will pounce on him, bite him, and give him a life-threatening disease. He rarely leaves his house as a fear of encountering a cat, and he regularly calls in sick to work because he does not want to leave the house. This behavior means that he finds it hard to maintain employment. Neil can't remember a specific time when he had a negative encounter with a cat that might have precipitated or developed his fear, but does remember that both his mother and father were both very anxious people. He realizes that he has a problem and has read online that breathing retraining can help with controlling symptoms associated with anxiety. In the last week, he has begun to use breathing retraining practices, and he has read about every day that he has read about every day and is finding them to be beneficial. All right, so the part A of the question says, explain the role of operant conditioning in perpetuating Neil's phobia. Okay, so that's the basic question. What do you guys think might be some key words we might include there, include in that particular answer?
Can we talk about how his phobic stimulus is the cat and how he avoids leaving the house, which acts as a negative reinforcement for him, causing him to like, how do I explain it? Like re-engage in that same behavior?
Yes, exactly. Those are some good points. Yeah. So all of those points you just included, we would mention in our answer. So how we would mention them is, just like you said, because this question is about it's about operant conditioning, we would have to include the type of reinforcement that the avoidance behavior brings, which we know is negative reinforcement. So what we would write here is, oh my God, why is that so huge? Okay. 16. Okay. So we would write Neil has a phobia of cats, he engages in avoidance behavior, example, not going to work, to prevent being exposed to a cat. Okay, so that's one mark for indicating the avoidance behavior there that he engages in. And it's always good to try to use an example from the scenario just to make your answer more specific. The next mark will come from when Neil engages in avoidance behavior or shows avoidance behavior, he is able to feel a sense of relief that he didn't see a cat. Okay, this acts as negative reinforcement. So we mentioned the word negative reinforcement in the second part of the answer here. Then we tie it up and we talk about what's the effect of the negative reinforcement. So as a result of this, Neil is more likely or has an increased likelihood of, again, showing avoidance behavior in the future in order to feel the same relief. And that's one mark. Okay, oh, whoops, sorry, we have to also mention thus maintaining or perpetuating this phobia. Okay, so that's basically where your 3 marks come from. In your response, include specific reference to the type of consequence involved. Type of consequence means you need to mention the word negative reinforcement. So the key words in this answer are avoidance behavior. Okay, that is a key word related to phobias, and we always need to use that whenever we get an operant conditioning perpetuation of phobia question. It's always good to put in an example. Okay, you need to indicate that he's feeling some positive feeling or some sense of relief or comfort as a result of engaging in that avoidance behavior, and that's acting as negative reinforcement. And then you need to indicate the effect of the negative reinforcement. So he's more likely, or, so you don't have to use both those terms, you can use one or the other, more likely or has an increased likelihood of again showing avoidance behavior in the future. And then you need to tie it back to the word perpetuating by saying thus maintaining his phobia. Okay, that's how you would perfectly answer a question like this one. Okay, so that's basically that answer there. So let me just make that red. Okay, the next question is, Neil's experience indicates that he may be experiencing cognitive biases that influence his thought processes around cats. Name any one cognitive bias that is evident in this scenario and indicate how Neil demonstrates this bias with reference to the scenario. So I'll just move back up to the scenario and just have a read of that scenario, just skim through and see if there's any specific type of cognitive bias you can see Neil demonstrating there. Yeah, catastrophic thinking. Yeah, so where's that line? Yeah, here. When he first sees a cat, the first thought he has is that they will pounce on him, bite him and give him a life-threatening disease, which is again an example of catastrophic thinking. Okay, so that's why that would be the best answer there. So we can just scroll down. Okay, we can even talk about memory bias as well, but I don't think we actually learned about memory bias in our book, so I won't talk about that. Memory bias is when we remember things as being more threatening than they actually were. What did we learn about memory bias actually? Hold on, let me go back and check.
Miss, we did.
We did, yeah? Okay,
yeah.
I keep getting confused between what was in one book and what was in the other. Okay, so memory bias we have learned about. So you can see memory bias is also demonstrated here when he often finds himself remembering prior experiences with cats. And when he does this, he always remembers them being far more large and far more threatening than they actually were when he first saw them. So that's an example of memory bias. Okay, and then the yellow one is an example of catastrophic thinking there. So I'll just highlight this so when I upload it later, you guys can understand where we got that information from. Catastrophic thinking. All right, so I'll just give you guys like a sample answer for one of them. In fact, what I'll do is I'll just copy paste this whole thing so then we can quote that underneath. Okay, so then with this answer, can't delete the lines. Why? Delete rows. Okay. So name one cognitive bias. So the first question or the first part of the answer comes from us naming that. So we would go catastrophic thinking. Okay. And then we could say, oh, let's just write it properly. Let's say Neil demonstrates catastrophic thinking. Full stop. And then that's 1 mark. Okay. And then you get the other 1 mark for justifying with reference to the scenario how he does that. This is because he shows thinking when thinking about cats, he does so in a way that reflects a worst case scenario or the worst possible outcome. As seen when he, and now I'm going to quote that bit of information, when he believes cats will pounce on him, bite him, and give him a life-threatening disease. You don't have to quote the whole thing. Even if you just mention he believes cats will give him a life-threatening disease, that would be enough. Okay, but just showing you guys that that's how we would embed that bit of information there. So that's going to be 1 mark for justifying with reference to scenario. So 1 + 1, that gives us the 2 marks there. So the keywords we'd include in here, obviously the name of the cognitive bias, and then we would also talk about the justification. So we'd say it's the worst, thinking about the worst case scenario, worst possible outcome, and then including some evidence from the scenario to justify that. So that's worth the 2 marks there. Okay. So let's keep moving on. So Priyanka has been struggling in trying to hide her mental health issues from her family. Most days she feels stressed and anxious and does not want to leave the house. She has missed many of her friends' birthday parties as well as social events for this reason. In addition to this, Priyanka has been missing out on a lot of her university classes as she can rarely gather the motivation to leave home and attend. She just doesn't see the point of it anymore. Furthermore, her family do not really acknowledge mental health as being a legitimate issue, often belittling people who claim to have mental health issues, passing them off as being over-emotional, dramatic, and weak. As a result, Priyanka struggles in silence, and despite her friends advising her to seek professional help, she refuses to do so. And then the question is, would Priyanka's experience be considered characteristic of a mental disorder? Justify your response. So what do you guys think? Let me know. Do you think she's got a mental disorder in this case or she doesn't? Yes, she does. That's correct. Okay. So the first answer would be, would Priyanka's experience, so we address the first part of the question first. So would Priyanka's experience be considered characteristic of a mental disorder? That's a yes or no question. So if we say yes, that's kind of 1 mark there. Or you could say yes, she demonstrates characteristics of a mental disorder. Okay, so that's 1 mark for just saying yes. Okay, and then the second mark, or sorry, how many marks is with? 2 marks, yeah. So the second marks comes for justifying one thing from the scenario, just one reason as to how you know that she's experiencing a mental disorder. So a few of you mentioned in the chat box that she's showing an impairment or a dysfunction to her normal day-to-day functioning. So that's correct. You can even talk about maladaptive behavior as well. That would be fine as well. Okay, so or atypical behavior. So maybe she's usually someone who goes to a lot of parties and social events, but she's showing atypical behavior. It's not typical for her to miss her friends' birthday parties, but because of her condition, because of her mental disorder, she is showing that atypical behavior there. So anyway, there's a range of answers we can have for this, or range of reasons, but we'll just maybe go with the impairment or dysfunction to daily functioning there. So this is because Priyanka is not attending many social events, such as her friends' birthdays, which indicates an impairment to her daily functioning. Okay, so impairment to her daily functioning, and we'd bold that up. And then obviously when we mention not attending her friends' birthdays or not even going to university, that would be the example from the scenario. So that would be 1 mark there, okay? So you always need to link back to the scenario by giving that example there. Otherwise, it's going to be too general and that you might not get the full marks there. Okay, so always make sure you're linking back to the scenario. So you could say this is because Priyanka is showing impairment by not going to her friends' birthday parties or by not attending university. So that's important to mention. All right, so oops, turn page over. Okay, got another question here with reference to okay, so Susie was repeatedly swooped by magpies whilst on a holiday with her family 2 years ago. The experience was horrifying for her, and ever since she has had an intense and irrational fear of all birds and often experiences panic attacks when she sees a bird. Susie is so distressed about encountering a bird on her way to school that she often tells her parents that she feels sick and asks if she can stay home for the day. Susie's parents book an appointment with Dr. Pham, a psychologist who specializes in the treatment of anxiety disorders. Dr. Pham suggests that Susie use systematic desensitization to help overcome her fear. She also provides Susie's parents with a booklet outlining the nature of Susie's anxiety disorder and the ways they can assist Susie in overcoming her fear of birds. After a number of sessions, Susie feels much better about birds and no longer worries about traveling to school. Over a year has passed and Susie no longer avoids birds or feels any fear in their presence. Okay, so that's the scenario. And now the first part of the scenario is to talk about the systematic desensitization. Now, this is a hard question, okay? Hard in the sense that there are 4 main things that you need to include. Now, if you study the PowerPoint and you look at how the main 4 steps of systematic desensitization are shown in the PowerPoint, you would basically have an idea of what 4 things you would need to include there. Can anyone tell me, it doesn't have to be in specific order, just tell me what are some of the key words or key concepts you might include in an answer like this one about systematic desensitization? Yep, fear hierarchy. Fear hierarchy is definitely one key concept there. Relaxation techniques. Yep, in fact, relaxation techniques is the first thing we're going to talk about. So Susie would use systematic desensitization by first being taught a relaxation technique. And we could say such as breathing, retraining. Okay, to breathe in a calmer way. Okay, that's the relaxation technique. That's 1 mark. That's our first step. The second step, does anyone remember what the second step is? I think it's been mentioned in the chat. It's fear hierarchy. So Susie would then work with her, what's the name of her psychologist? Dr. Pham. Okay, work with Dr. Pham to create a fear hierarchy. Okay, and then you're going to indicate which orders tasks in terms of being least fear-inducing or least fearful to most fear-inducing. Most fearful. Okay, until eventually Susie is exposed to the actual phobic stimulus itself. These birds, which are birds. Okay, so here you're going to get let's see. So you got 1 mark here, 1 mark here, 1 mark here. Oh, yeah, sorry. So here you get 1 mark for mentioning that she's going to create the fear hierarchy, and then 1 mark for indicating what the fear hierarchy is. Okay, so what I'll do is I'll separate this, the fear hierarchy. Okay, and then the last mark comes for you talking about examples of what we would include on the fear hierarchy and how Susie would work through that. So we would say that Susie would then go through the tasks on the fear hierarchy. And then you give some examples of those tasks. So until the last task no longer produces the fear response. And then you give some examples of tasks. Example, really, what's an example of a low-level task, guys? Something that's not very fear-inducing with reference to birds.
Looking at them, maybe.
You mean in real life, or like maybe?
No, a picture.
Yeah,
or
so maybe
kind of.
Yeah, looking at a picture of a bird. Okay, and then maybe we could say, let's say maybe watching a documentary about birds. Okay, and then maybe we could say sitting on a park bench in front of a, I don't even know if it's called flock of birds, I don't know. Okay, so in front of like a bunch of seagulls or something, you're sitting on a park bench. So that last step there is pretty scary because you're right in front of the bird. Maybe you'd even be asked to hold one of those birds in your hands. Okay, so that's the basic idea. You just have to mention 1 low-level task, 1 medium level, and 1 high level. So I'll just mention that here. So when you're going back through this, it makes sense. So low fear inducing task, medium fear inducing. And these are your own examples. As long as the example makes sense, there's no set examples here that you can just make them up, but they've got to seem scary, okay, or seem not scary there. Fear inducing task. Okay, so that's the thing. So the key words you're mentioning here, first of all, being taught a relaxation technique to breathe in a calmer way. And what basically happens is when you're taught the relaxation technique, you're taught this because as you go through each task, you can use that breathing technique whenever you feel your anxieties going up. And yeah, that's the first one. And then the second one is to create the fear hierarchy. Okay, the third one is to order what the fear hierarchy is, which is basically up to here. Okay, and then the last task would be to go through the tasks on the fear hierarchy until the last task no longer produces the fear response. That's when we know that systematic desensitization has been successful. And then giving these examples is also necessary for the full marks there. So that would be 1 mark. Okay, obviously, I'm just trying to break it down into the steps, but it's kind of hard to break it down into the steps like this exactly. Some students might mention the relaxation technique a little bit later in the answer. That's fine. There's no specific order as long as everything's there. Okay, so that's where the 4 marks comes from. Okay, Neil used a breathing retraining technique when Neil, who had the phobia of cats from the previous scenario, and Susie, who's got the phobia of birds, used systematic desensitization to help overcome their symptoms. So they're both using some kind of strategy there. What stage of the transtheoretical model of behavioral change are Neil and Susie currently in respectively? What do you guys think? Yeah, they're both in the action stage. Okay, now with this question or with questions like this, generally they kind of throw students off because students are like, are they supposed to be in different stages? They're actually in the same stage. And look, if you get a question like this and you have a feeling that they are in the same stage, just write that they're in the same stage because they are. Look, Neil is using a breathing retraining technique, which is an action. It's a physical behavioral modification. Susie is using systematic desensitization, which is also an action. It's something actively that she's doing to get rid of her phobia. Okay, so that's why we can say that they're both in the action stage of the model. So we can say both Neil and Susie are in the action stage. That's 1 mark for mentioning action stage. And you really need to mention here, because there's 2 people in this question, you need to mention both Neil and Susie. If you just say action stage, it's not clear as to who you're referring that action stage to. So mentioning the word action stage or just action is 1 mark, and then justifying your answer. So you can say, this is because Neil is physically engaging in breathing retraining, and Susie is also physically modifying her behavior through systematic desensitization, or something along those lines. Okay, just mentioning something about them actually physically engaging in some behavior there, or actually physically modifying some behavior. Okay, so that's basically the 1 mark for justifying. So that's 2 marks there. Okay, what's the next one? Our next one's pretty straightforward, just from the PowerPoint, straight from the PowerPoint. Outline 1 strength and 1 limitation of the transtheoretical model of change. So can anyone tell me what's a strength, 1 strength, and what's 1 limitation? Okay, so a strength is something obviously positive about the model. Okay, when we talk about strengths, we can talk about this idea that the transtheoretical model acknowledges that behavior change is not an overnight or one-time process. Remember, it's a stage-based process, and that it does require a time commitment over many stages. Okay, so that's one of the strengths. Okay, it doesn't give people false hope and make them think that, oh, I can change my behavior overnight. It's more realistic, okay, in that sense. Now, what about a limitation? Does anyone know a specific limitation that we can talk about?
Yes, you know, you have to undergo action for at least 6 months, I think, in the maintenance stage, was it?
Yep.
Could that be a limitation? Like, there's no evidence. Some people might need to do it longer.
Yeah, that's correct. So we can talk about the time frames. So the specific time frames given in the transtheoretical model of behavior change don't have much evidence to back them up. And are not accurate and may not be accurate. Example, some people may take longer to move from one stage to the next. So yeah, that's a good limitation there. Okay, so each one is worth 1 mark there. So you've just got, 2 marks there. Okay, don't have much evidence to back them up. Okay. Yeah, so for Susie, it mentions that after a year, she doesn't avoid, but that's a previous question. Let me have a look at that. Oh, this question, yep. Yeah, so even though it says that Susie has avoided birds for almost a year, in this specific part of the question, it's not talking about her actual recovery from the phobia, but rather just the part of the scenario where she uses systematic desensitization. So that's why in this question, Susie is not in maintenance, but is in action, because it's only referring to her use of the systematic desensitization to overcome the symptoms rather than her overall recovery story or overall recovery journey there. Yeah, but if it was asking you, for example, after 1 year, what stage is Susie in? You could then say maintenance, because she has maintained that behavior. She has maintained her ability to, you know, not engage in avoidance behavior for more than 6 months. So yeah, that's a good point that you mentioned. Okay, next question. Oops. Okay. Carol is, let me just save this. Carol is 35 years old, and 3 weeks ago, she lost her job at a company where she had worked since her 20s. Carol grew up in a rough household and where her parents were always arguing. And Carol was an only child, so she felt very alone in the struggle. The only form of stable social support Carol had growing up was her grandmother, who would help her with her homework and give Carol money for school-related costs. Sadly, Carol's grandmother passed away last month, which brought Carol a lot of grief. Although Carol has 2 children, they barely visit her and are both settled in different states. Carol is now worried for her future, as every new job application she submits is met with rejection. She has started to lose faith in herself and no longer believes she can get a good job or ever succeed in life. As a result, she has given up trying and stays at home crying in bed. So sad. Okay, so part A. What do we think part A is? Identify one social risk factor, knowing that there are specific social risk factors we've learned about. Which one is she going through in this scenario here? So social risk factors. So in I think our social risk factors were disorganized attachment, loss of a significant relationship, and stigma, if I remember correctly. So out of those 3, which specific factors, or which specific factor is affecting her in this scenario?
Can you say loss of significant relationship?
Yep, that's correct. So loss of significant relationship would be the answer here. And who is the significant relationship in this scenario?
Her grandmother.
Her kids.
Yeah. So her grandmother is the what's it called? The significant relationship that she's lost. So Carol has experienced a loss of a significant relationship as a result of her grandmother's. Oh, wait, sorry. The question is just identify. So you don't even have to write all of this. I'll just write loss of a significant relationship. That's it. That's it. 1 mark. Okay. Just about the keyword there. Okay. So that's the answer. Okay. So now with reference to cumulative risk and the scenario, comment on the likelihood of Carol developing a mental disorder. We've done a similar practice question to this when we did cumulative risk. So all you're going to do is look at the risk factors that she has and look at any protective factors she has and whether the protective factors will save her from developing a mental health disorder. So you're going to have 1 mark for saying yes or no, yes mental disorder or no mental disorder, and then 1 mark for justifying. So what do you guys think? Yes or no? You can even just add maybe a little bit of stimulus material. Yes, correct.
Maybe yes.
Yeah, it is yes. Okay, I'll explain why it's yes. I'll just delete this table. All these rows. I don't know why these lines come like this. Anyway, it doesn't matter. Okay, so we would say
she has nothing good anyway to talk about for a protective.
Yeah, I know she doesn't. She doesn't have anything that's a silver lining for her, any kind of support there. So that's why we would write that. So we would write yes. Oh, sorry, not yes. It's not a question, comment. So we would say Carol is very likely or highly likely to develop a mental health disorder. Okay, so that gives us 1 mark. We don't say, oh yeah, Carol is absolutely going to develop a mental health disorder, because we can't make absolute statements or overconfident statements like that, but we can say yes, she's very likely or highly likely or at a very high risk of developing. In fact, we'll mention the word risk because this is a cumulative risk question. Okay, so mentioning that she's got a high risk of developing a mental disorder is going to be the first part of that question there. And the other 1 mark comes from justifying why that is with reference to cumulative risk and the scenarios. We can say, we know that cumulative risk is about the total effect of a number of risk factors. So we need to talk about that or bring that keyword in. So we can say, this is because the total impact or effect of risk factors in Carol's life. And now this is the part where you want to name some of those risk factors just from the scenario. So we can talk about losing her job, What else is there? Growing up in a rough household. We can also talk about loss of a significant relationship, not seeing her children, okay, rejection in job applications, all this stuff, all of these are risk factors. So this is because the total impact or effect of risk factors in Carol's life outweigh the presence of any protective factors, which would otherwise alleviate Carol's mental health state. Okay, or something along those lines. It doesn't have to be word to word. So this is a 1 mark. So you basically need to mention the total impact of the risk factors in her life. And you don't need to give all these examples, but even if you can just give maybe 2 examples. Okay. And you need to indicate how the risk factors outweigh the presence of any protective factors. So in other words, you need to say that the risk factors in Carol's life are greater than the protective factors, and that this is what equals to the higher risk for mental disorder. Okay, remember in that scenario question we did when we covered cumulative risk, I think it was about a guy called Milos. And Milos, even though he was going through risk factors, he had a supportive wife who could work and earn some money for the family until he got back on his feet. He was applying for jobs himself. And even though he was getting rejected, he kept trying. So he had that resilience. Whereas here we can see that Carol doesn't have that resilience in her in the same way. And you can understand that because she's gone through trauma from when she was a child, growing up in a rough household, her parents arguing, not having a sibling that she could lean on for support either. So there's a lot of stuff that she's gone through in this scenario. So it's clear that we can see that, you know, that's what led to her high risk of developing the condition. Alrighty, cool. We came to the end of the booklet. That's good. And it's not even 10:40 yet. Awesome. Okay, so guys, any questions about any of the stuff that we went through today? Any of the questions that we went through today? Or look, these are very, yep.
Sorry, Miss, do you mind if you go to the top of the multiple choice? Because I came a little bit late. I want to see what
sure.
the answer.
Sure, no
there's a
worries.
question, Miss, there was a question about you know, a person who has a specific phobia, what are some things that they might feel? And I wasn't sure of that answer.
Oh yeah, is it that one, question 2?
Yeah.
Yeah, it's irrational, because irrational means that it's like me saying, oh my God, that spider that's like so small is going to eat me alive and is going to be the reason for my death. So it's a bit irrational, like you think in a very unreasonable way rather than rationally. And intense means that the fear response that those people feel really highly activates the sympathetic nervous system, causes them to have like a panic attack, even in some cases causes them to hyperventilate. So the fear response is very intense in that nature. Yeah.
Oh, Miss, I thought it was negative important. Like, you know what I mean? Like from their perspective, it's negative and it's something that's important for them.
You could look at it that way, but the way the question is, in terms of the actual characteristics of specific phobia, I think option C would be better. Important from their perspective, but not important in the sense that it doesn't really allow them to live properly or to basically engage in their normal functioning. So important wouldn't be the negative, is definitely correct, but important wouldn't be the best word there. Yeah, if that word, however, was something like significant, that would be okay. Then option D would be an alternative answer there. But important itself is not the best word, I would say, for that question. So that's why the best answer would be C. Any other questions, guys? Also, I do need to show you guys a few things I want you to do as well for revision. So what I'll do is I'll just stop the recording here.